Yeah, go ahead and go into presenter mode. And
Okay.
Okay. Well, good morning, everybody. Thanks for attending this session. The title of this session is Mapping COVID-19 Incidence Rates and the Relationship to Food Insecure Areas in North Carolina. Our speaker today is Dr. Tim Mulrooney. He's an associate professor in the Department of Environmental, Earth, and Geospatial Sciences at North Carolina Central University. His teaching and research focuses on GIS, spatial data development and standards, by which GIS data can be created, stored, visualized, and cataloged. And before I turn it over to you real quick, Dr. Mulrooney, just to let everybody know that all the sessions at the conference are being recorded and will be in our YouTube channel. So you can pay full attention to the presentation this morning. And if you have questions, if you would, in your browser window, go ahead and pop open that chat and enter those as we go along, and I will moderate those and we'll get those answered for you as we wrap up. So with that, take it away.
Okay. All right. Thank you very much for having me here. The title of this is called Mapping COVID-19 Incidence Rates and Measuring the Relationship to Food Insecure Areas in North Carolina. This is part of some work that's combines the recent COVID-19 pandemic, prior research on the spatial representation of the food environment, data environment efforts that's kind of near and dear to my heart. And I've been working with BBRI on the NCCU campus, which is the Biomedical Biotechnology Research Institute, the Department of Public Administration, the Department of Kinesiology and Recreation Administration on part of this work since this summer or so. Basically, we all know about the COVID-19 pandemic, but the North Carolina COVID-19 dashboard has provided robust data and statistics, graphs, charts, visuals about anything and everything related to the pandemic. And me being a GIS analyst and want to look at and explore the spatial patterns attached to them, I really thought it was neat to kind of get into the data and look at those and play with those and download those on a regular basis. So in terms of the actual data are collected at the county level and the zip code level, and starting about May or June, they were starting to be collected at the zip code level, which is a lot finer than your county level, which included data such as the total cases, the COVID-19 rates per 10,000 and per 100,000, and for this presentation will be per 10,000, total number of deaths, and it's just downloadable to a tabular format that can be brought into a GIS, massaged a little bit, and mapped using the appropriate links. So you can see to the right some of the data that we have, and over at the dashboard, you can select your particular geographies that have at the county level. That we started doing in March and April, and migrated over to the zip code when those zip code level data became available in about May or June or so. And we downloaded those for cases per 10,000 residents, and it's got some kind of WYSIWYG maps there that you can have, but I like to download those and import those into my GIS and make the maps that are appropriate for me. So with the zip code level, we've got 763 zip codes in North Carolina, and according to the North Carolina COVID-19 dashboard, a COVID-19 case is defined as a person who received a positive COVID-19 case test result. People are only counted as a case once, even if they've received multiple tests. So in essence, the number of cases and the rates are cumulative, so they can't go down from one day to the next. And I started collecting these at the zip code level amongst a number of different days. So I collected in July, in September, in October, in December, and recently a few weeks ago. So you can see the rates, and we have low rates of 0. So there are some zip codes in North Carolina that have literally no cases. And then our highest rates are about 3,000, 3,200 for every 10,000 residents for that particular county. And then you can see the means for those. I've got a chart here that just shows a histogram of the count versus the rates, and this is as of January 24th, 2021. And of course, with those, I like to make maps. So these are my maps. This is a quantile map here of the 763 zip codes, and you can see the high rates and the low rates here. And you can see, our high rates here through eastern North Carolina, and then we've got a really big area to the west and west and northwest of Charlotte. Our high zip code is over at Swan Quarter in the eastern part of the state. And then the other thing I like to do is cluster mapping. So we use a metric called the Geographic metric, which measures high COVID-19 rates surrounded by other high COVID-19 rates, as well as cold spots, which are low COVID-19 rates surrounded by other low COVID-19 rates with statistical significance. So you can see the areas, and this is as of a Halloween, end of October 2020, and you can see the hot spots represented in your reds and your pinks. And I thought it was interesting, this U-shaped pattern that went right around Cumberland County and Fort Bragg. This is this U-shape, and then like I showed before, you can see Mecklenburg County as the areas to the west and northwest start to proliferate at this time. And we have the cold spots, which are around the Research Triangle, and then northeastern North Carolina for the most part. And we've got some others sprinkled out in western North Carolina. But I want to do a little bit of change detection to see where these clusters are changing. So you can see a cluster map here at the end of October. You can see one early December. And then you can start to see this U-shaped pattern start to disappear, and these COVID rates cluster over towards the west and northwest of Mecklenburg County. And then as of the last time I collected these data, which were about 3 weeks ago, and you can see this U-shaped pattern has pretty much disappeared. With the cold spot here in the Research Triangle has gotten much bigger, and this big hot spot to the west and northwest of Mecklenburg County has gotten much, much larger as well. So one of the things we wanted to do was look at change detection analysis to look throughout the state of North Carolina where we're having trending hot spots, trending cold spots, and little to no trend change. So these trending hotspots would be these areas that are going from low clusters, areas that have no statistical significance expressed, to hotspots, and then these cold spots, which are moving in the hotspot direction. So cold spots, the no clusters. And we had absolutely no incidence of cold spots, the hotspots moving from one extreme to the other extreme. And the same thing with the trending cold spots. We didn't have any zip codes that went from hot spots to entirely cold spots, but we did have some zip codes that went from low clusters to cold spots, and then hot spots to no clusters, which were trending in that direction. Little to no trends showed hot spots that were still hot spots, cold spots that were still cold spots, and then no clusters that were still no clusters. And so this was this change detection that we've been doing. And you can see that the two areas in red, the areas in red, areas in pink were just hot spots that remained as hot spots, but the two darkest in red were the new emerging hotspots that I called them that were popping up. And you can see where they're coming up here, the west and northwest of Mecklenburg County. We can see up here, I think this is Yancey County, and a little out here, out towards Swan Quarter. Most significant that I thought were the emerging cold spots. So this U pattern that we saw here, I saw throughout the summer, and then at the end of October, has largely disappeared. And then you can see this growing cold spot of COVID-19 cases, which are the low COVID-19 rates surrounded by other low COVID-19 rates proliferating in Research Triangle area. So combining these, we wanted to tie these together with this project that we're doing through the Accord project, and I'll talk about that in a little bit. With food security. And food security is having the economic and physical access to sufficient, safe, nutritious food that meets their dietary and food preferences for an active and healthy life. Me being a GIS person and a quantitative geographer, I always like to put these in numbers so we can put these into 4 basic tenets, which is food availability. There's a lot of different ways to measure those. We've gone down some rabbit holes with those, but mainly we look at proximity. How close are you to healthy food or unhealthy food? What's your density of food, meaning what are the number of food outlets compared to unhealthy food outlets for your zip code or for your census tract? And then, like I alluded to before, variety, how many unhealthy to healthy or ratio percentages are there within a particular enumeration unit? And those can all be calculated fairly easily using a GIS, as well as these days with temporal access, so that the changing hours of food outlets is change the actual availability. So maybe places that were open 24 hours are no longer open 24 hours that restrict availability. Access brings in a transportation component. So even though food is relatively close to you, have the ability to get to it. And then the idea of food utilization is, if we do put a healthy food outlet next to someone, are they still going to drive miles for unhealthy options? And so we can look at things like spending patterns, or quantitatively look at spending patterns for some of these data as well. so we can get to an ultimate state of food stability. So the data that we have on food desert, and we've heard this term for the last 15 years or so, there's been areas with limited access to healthy food combined with a poverty component. The USDA Food Access Atlas contains data that can be brought into a GIS and mapped. It's got a map or a big Excel CSV file of all 73,000 census tracts with about 150 different attributes that combine income, group quarters, demographics, and what we look at is low income and low access. And so we can bring these in, link and join these to GIS at the GIS data at census tract level for the 2,100 or so census tracts that we have in North Carolina. And you can see this is a map of food deserts essentially here in North Carolina. We've got urban food deserts, which are areas more than a mile from a healthy food outlet, and then in rural areas they're classified as more than 10 miles. And we've done some research on how do we measure the 1 mile and the 10 miles, because I care more about driving time as opposed to actual distance, actual crow fly distance. So there's been some neat research into those that I won't get into here. And then we can combine these with things like our spending patterns. So we can see a map here of spending on vegetables in dollars per year. So you can see where spending on vegetables is really high in your blues and your greens. It's much lower in your light greens and your yellows. This is a map that we created with North Carolina A&T, where we look at the economic tier. So your tier 1, which is your most distressed, down to your tier 3, which are your least distressed. So what we try to do with tying the COVID-19 rates and the insecurity data, since they're collected at different enumeration units, and this is fairly coarse here, since the COVID-19 data are collected at the zip code level and the food desert data are collected at the census tract level, we did a simple select by location to find zip codes which contain the centroid of a food desert census tract, because it was going to be really difficult to assign it was going to be difficult to assign COVID rates to each census tract. So what we try to do is figure out which of the zip codes, which already had our COVID rates, had data for spending that we could apply classify as food deserts. And so you can see these census tracts in gray and brown right here are kind of coincide with the zip codes which are highlighted here. So these are the census tracts that we kind of caught as zip codes here. So these zip codes here that are highlighted, these are our quote unquote food desert zip codes versus our non-food desert zip codes. And we did this with some simple spatial overlay. We kind of lost one little food desert census tract here, but it was really small compared to the rest of the entire zip code. And so we were able to superimpose these. And so you can see that North Carolina food deserts and COVID incidence rates. This is as of October 31st. This is as of December 10th. And then this is as of January 24th. And so what we tried to do was just run a test of two means, test of two means between the COVID-19 rates taken at different dates. And so our COVID-19 rates in food deserts we saw were higher than non-food desert areas. So July the 6th, in the food desert regions, the COVID rate was 70.85. In the non-food deserts, it was 55.71. And you can see in the food deserts are all higher, and in some cases with statistical significance. Some other data we started to look at was COVID rates in rural regions versus non-rural regions. And so we can see they're always higher in rural regions versus your non-rural region, in a couple cases with statistical significance. And then also in our rural food deserts versus our rural non-food deserts, they were all higher in some cases with statistical significance. And so I thought it was really interesting, the maps and the patterns that we had, and then starting to answer some of the questions of why. Now, I'm not a big why person. I like to tell people I'm kind of the map geek that works with the data and does the clustering and makes the maps look all pretty, and then try to figure out the whys. Some of my colleagues in kinesiology and recreation administration, as well as public administration, and the folks over at BBRI. And so they developed a COVID-19 survey, and I thought this was interesting. So we gave out a survey to about 1,345 respondents. We had about 1,500 people participate, but these were the number of responses across 97 counties, and this was highlighted around Thanksgiving. So I thought this is pretty interesting. where that some of the data that we created with the Advanced Center for COVID-related Disparities project, and it's called the CORD through our BBRI. And right now we're working on mapping these data at the zip code level. If we have enough data, what we saw, 17% of people experienced at least one day without sufficient food supplies. 32% of our respondents reported loss of income during COVID-19. 60% of our households experienced food security, had at least one child at home, and 77.4% of households, and we finished this up around Thanksgiving, were planning on considering a shared meal with people outside of their home on Thanksgiving. And then another 38% could not rely on neighbors to shop for them if they actually became sick from COVID. So we thought this was interesting, and this is some of the spatial data we got from this. Right now, I'm starting to work on the spatial data because we did collect zip code level data for these particular data. We're just hoping we have enough data and enough samples for these particular zip codes. Obviously, it won't be able to be compared to the COVID-19 data, but hopefully we can make some interesting maps out of these. Just looking at the spending patterns in the food deserts in the rural regions, we can see that the spending on fruits and vegetables in this case combined in our food deserts is much, much less than our non-food deserts, and it's much, much less in our rural regions with statistical significance at 99% in this case. And you can see our food deserts here versus our spending on fruits and vegetables. So we had a lot of interesting results here. One of the things that we saw, we've got COVID-19 data can be collected and mapped at the zip code level. I really like doing this. I really like using this as a teaching tool in my classes because it's real world data that we can download and it's changing, so we can do things like change detection analysis. And it's also led to some other mapping projects that we're doing on mapping COVID-19 versus by mail voting patterns for the 2020 election. So right now, me and Dr. Chris McGinn at North Carolina Central have a paper where we utilize these COVID-19 rates, and then he's doing research on by mail patterns because by mail mail-in rates were extremely high for the 2020 election. We've already processed these data and looked at the relationship between COVID-19 rates and by mail, so combining his specialty and my specialty on these. And he'll be presenting tomorrow at 4 o'clock on the by mail patterns, and hopefully you'll see our paper in the near future on these because there are interesting results that I didn't really expect to see. Our highest COVID-19 rates were largely in Duplin, Sampson, Wayne counties, and then starting to migrate over to Gaston, Lake, and Catawba counties. Our cold spots and our consistent and persistent cold spots were in northeastern North Carolina, Carteret County, and the Research Triangle, which was even getting bigger. And then our food desert data, or what we call our low income and low access, provided through the USDA. Even though we're starting to do some more accurate and higher resolution calculations, we're working on a paper where we're using population weighted centroids instead of just the centroids block groups and census tracts, which can be which are random for the most part. And we're looking at population weighted approximators for source locations, which has been better instead of mapping every single address, which we've done for Guilford County once. Another thing, our COVID-19 rates were higher in food deserts than non-food deserts, as well as rural regions and even rural food deserts versus their counterparts. And our surveys that were highlighted by my colleagues over at Public Administration and KRA highlight there was lost income due to COVID-19, and we've got spatial data being supported in support of these endeavors. And so this is my information here. We've got a couple of projects that were part of this. This part of the food desert research has been part of an NSF grant that I have with North Carolina A&T, and then the part of the COVID-19 data development has been part of the Advanced Center for COVID-related Disparities, headed by the BBRI on our NCC campus. And that's about it.
Okay, great. Really interesting. I'll start off. There's a lot of kudos coming in on your work. What was your biggest surprise as you started to do these various analyses?
One of them, I just didn't know, and I kind of went in really open. I went in really open, figuring out I didn't even know where COVID rates were going to be high, where they were going to be low, really low. Another big surprise, and I put these maps on this as well, when we started to combine the research with Dr. McGinn's with the voting patterns and the COVID rates, we thought the Bimail and the COVID rates would be really high, but we saw the exact opposite. Where there were high COVID rates, there were actually low Bimail voting rates, which was totally opposite of what we would expect. So, and we started to break them down by party and setting, metropolitan, and rural. But I think the biggest party was just the biggest surprise was just seeing where they're high and where they're low. You kind of sometimes think there's random stochastic phenomena out there, and there aren't. And in some cases, Research Triangle was really low, but in Mecklenburg County it was really high, even though they're both urban areas. And so I went in this with an open mind, and it's still open, to be honest with you, figuring out the whys attached to these.
And is there any interest, or do you have any potential plans to do the same type of thing with vaccination adoption or anything along those lines as the pandemic continues?
Yes, we're looking. I've been working with Dr. William Pilkington. He's our Hope Project, he's an extension project manager down in Cabarrus County at our research campus, and he's been working in the field with vaccinations. So we are looking to. He's been doing testing, but we're looking to do some work with the vaccinations and getting numbers on those. And he's been really useful in helping to get that information so I can turn to the maps and look at the data with members of the other team.
Great. Well, that'll definitely be interesting to, I'm sure, a lot of people, but especially me. It's been really interesting to follow different analysis as this is unfolded. I'd like to thank you for speaking again, and thanks to all the attendees. Just as a reminder, again, one more reiteration that this is going to be on the YouTube channel, so you'll be able to see this at a later time, and hopefully that'll be shortly after the conference. One quick question did come in, Tim, is where can I find a map showing your findings?
A map of it. We actually have a YouTube page. It's called DEGS-NCU, where we've highlighted our maps, and we're working on getting some story maps together. We do have a story map for the food desert research, but we haven't created a story map yet of all of this. So when I get a eager graduate student, I think I'll probably do that. And you can reach out to me personally here for any of the maps, and any of the data is attached to those, where I can create a map package or create a service essentially and publish those to our publish those as a web app.
Okay, cool. And here's a good one. Did you say that the high COVID rates were shown in low mail-in voting areas?
Yes,
wouldn't that be, and the follow-up to that would be, wouldn't that be in line with the no mask wearing along with the distrust of mail-in voting?
Yes, I thought it was. So, and this was the other chart that we made as part of our paper, where that when we look at by far the highest COVID-19 rates had the lowest Bimail rates, which were predominantly Democrat and rural. And so this was a lot different than what I expected. I would expect kind of the tenor at the time with the not trusting the mask to be more in line with Republican, where we'd have higher COVID rates and lower Bimail, but it was kind of the opposite. So the why, I don't know why, but this was, I have no idea on the why. I'm not very political to begin with. This was kind of the ending of our paper. We'd like to figure out the whys, and I'm open to anyone, maybe someone in social work or sociology. Chris McGinn, he's our political geographer who helped me process all 7-8 million voting records into a table that looks like this, that we grouped at the zip code level, and then within metropolitan and micropolitan areas. Maybe we'd love to work with someone there to maybe figure out the whys, why Democratic rural had by far the lowest mail-in rates, but by far the highest COVID rates, while our unaffiliated had low COVID rates and high mail-in rates. So I'm open to that. It's a very, very rich data set. I think it's got the potential for a lot of projects and papers, and and I'm open to someone out there who can help us answer the why to do that. So this is my contact information if you want to reach out to that and get some of the data on those and help us figure those out.
Okay, and I think we've got time for one more, and this is more of a general question, progression of observation here, but do you have any ideas as to what was driving how the southern coastal plain area, how the hot spots changed and dispersed over time?
I have no idea. I wish, I'm not, if I had Dr. Pilkington here, he can maybe answer, maybe they're high enough as it is. And so they just they were still high, but they just weren't hotspot high. I don't have an answer for those.
Okay, well, good, great. Well, thanks to everybody for the questions, and thanks for taking the time today, Tim. And if you do have follow-up questions, as he's shown, his contact information is on the screen there. Please jot that down. I'm sure, like you said, the possibilities are almost limitless with this, right? No matter what angle of analysis you want to take. So thanks for that. Guys, we have another session coming up here in about 3 minutes. So at this point, we're going to shut it down and let you jump over to that. And we'll talk to you later today. Thanks a lot.